There are a number of things in bathrooms then, and I think you need to think about all of these things. And again, if you think about it in terms of a risk assessment, you'll be able to say that you've been through that process, you've thought about things. So there's the slip resistance of the bath surface itself, there's the slip resistance of the bathroom floor. You've got to think about the users in the bathroom as well. If you're in the bathtub taking a shower, then you're going to be barefoot, and that means that the testing that is done is slightly different. You use a different slider rubber, and there is actually a pendulum that can be adapted to work in a bathtub, and Bonasystems have got one of those pendulums, and I've used it on a number of occasions now. On the bathroom floor, you've got both sorts of users. You've got barefoot users and you've got shod users, and that requires some slightly different testing, different information, and you need to be aware of both sets of information to make an informed decision. There's some other issues around bath surfaces. Cleaning and maintenance of them is obviously going to be important. One of the problems with a bathtub surface is that it will get contaminated with body fats, and one of the problems with body fats is that they're not visible, so the surface can be contaminated and the way that it behaves may be different, but it's not immediately obvious. Effective cleaning will get rid of that body fat, and if the surface is capable of giving a greater level of wet friction, then that will happen in that situation. There are other controls as well within a bathroom that you need to think about. Grab rails are important. Grab rails are a little bit like a handrail on a staircase. It's probably the first thing that the inspector or the insurance company will ask you about. You also need to think about the change in level between the bath surface and the bathroom floor surface, and also the step over height. It's the height that you have to lift your leg to get out of the bath. All of those things are known to contribute to the risk, and you need to be thinking about all of those if you want to know how to control the risk, or how to minimize, or how to reduce the risk.